evening and welcome to Health Plus Weekly. We have a great show for you tonight. We have a exceptional panel with us today. Dr. John Podkoa, primary care physician, is here once again, and special guest Amanda Raposa, who is a psychiatric nurse practitioner who owns Brighter Side Wellness here in New Bedford. So welcome to the show, both of you.
Hey, how are you?
Thank you so much for having me.
And today we want to focus on talking about depression around the holidays, but of course, like always on Health Plus Weekly, we welcome all your questions. Really cool new feature that we have today and moving forward, and that is the ability to text us anonymously if you have a question that you don't feel quite comfortable asking on the comment section of Facebook. You can send us a text message with that question instead. Again, anonymously, you can send it to 508-717-8948. Again, 508-717-8948, and we will have that number up on the screen for you throughout the night. So let's start off. Amanda, this time of year, I imagine that for multiple reasons, you're seeing more people who are suffering from depression. Why is that?
Absolutely. Well, around this time of year, people go through various kinds of losses, either the loss of a loved one, parents, husbands, wives, even children, or they've lost a job, a sibling, even an animal. Or sometimes just the financial burdens of the holidays can be a lot and overwhelming for somebody. So it can be a very debilitating time, and just depression is debilitating in general for people. So we see a lot of different people around this time of year that present with a lot of anxiety and depressive symptoms, and we do our best to meet their needs individually.
This time of year is, I think, interesting too because of the juxtaposition of happiness, this overwhelming media, kind of pressure that it's a good time, it's a happy time. There are plenty of people who the holidays are a great time of year. So one of the reasons we want to talk about it tonight on the show is depression is hard to talk about for a lot of people to begin with. I think it's harder to talk about around the holidays when everyone's just happy, cheery, and for so many people, they struggle because it may be going through their own tough time. So we want to hopefully shed some awareness to it, maybe have people bring in some questions they may have. We're going to talk about signs and symptoms of depression, treatments, and maybe some other common questions that we see. And one of the great things about the show and why I'm excited to be a part of it, I'm super excited Amanda's here, is that these are questions we see every day in the office, and this allows more time to talk about them and also more access to more people. So we also want to put out there tonight, if you know someone or who maybe perhaps the show is not geared towards you, but someone may be suffering from depression or have questions about depression, to share it, to post it, and to perhaps tag friends so we can increase awareness to an important topic.
What I tend to see a lot of when someone starts to present with depression is they're tired. They don't have a lot of energy. They feel fatigued. They look kind of flat. But one of the biggest things that I see is they no longer get pleasure out of the things that they once did. If it was riding a bike or going to the gym or just their hobbies, they just no longer get pleasure out of those things. So
I think that's huge. I think that's such an important point. Because people say, I don't feel depressed, but then you ask them, what do you like to do? And I like to ask my patients, what are their hobbies for a variety of reasons? But one of them is just so you can ask that question, like if you like to go bike riding or if you like to play golf, and you said, are you still playing golf? And they say, I could care less if I play golf anymore, right? It's a worrisome thing.
Or these headaches, or they come in with a lot of somatic symptoms or GI distress. That's a lot with anxiety, but the headaches I find is a common theme amongst people that are depressed or no ambition to get out of bed. That's when you start seeing more of the moderate to severe symptoms, where they start saying, just to get here, just to take a shower today was a chore. Those are starting to look into the more moderate to severe symptoms.
So how hard is it for people call that, I'm in a funk. How hard is it for people to get out of that funk? Does it all depend on the severity of what they're going through?
It varies. I've seen average, I mean, it varies per person. It can take 3 months, it could take a year, it could take a few weeks.
It's a good question in terms of what's the difference between being like a bit blue or down in the dumps, having a bad day, and when should you worry about maybe something more is going on? Is this a major depression happening, or even a minor depression? You know, and man, you can correct me. I typically tell my patients, so symptoms, first of all, is, you know, do you feel depressed or not? Or do you, like Amanda said, have you lost interest in the things you like to do? Other common ones are you sleeping, like, you know, more than you used to sleep, or are you not sleeping as much as you used to sleep? Have you experiencing excessive feelings of guilt or worry that you feel, you know, excessively responsible for some things?
Irritability is another one.
Yes. Energy, like Amanda said, I mean, big thing is just a lack of energy. Crying, tearfulness. I mean, people come in and be like, "Oh my God, I'm a mess. Like I can't."
Commercials.
Yeah. Why am I crying? I can't get through things. Pain, like you said, some people have a lot of belly pain, back pain, headaches. Of course, on the severe end, we always worry about are you thinking about committing suicide? Have you tried to commit suicide? And in those symptoms, the minor ones, not the suicide ones, the other ones, if they've been persisting for more than 2 weeks, that's a red flag. If we have bad days, we get tired, but if you're persistently tired, if you're persistently having bad days, and it's going on for more than 2 weeks, that's concerning. Or if you know someone, would you agree, or do you think
Absolutely.
Yeah.
Absolutely.
So, you talked a lot of different symptoms potentially. How does someone know that it's, you know, not something else on the spectrum of health?
Well, we rule out other things. We'll do blood work. We'll rule out any, you know, medical illnesses, thyroid disorders. That can also account for some of people's depressive symptoms. So we do a lot of that. I also utilize screening tools like the PHQ-9. I know now that's being administered at a lot of primary care offices. There's also the Hamilton depression tool, the Beck. There's a lot. They're called screening tools. You may have seen them at your physician's office where you have to fill something out over the last 2 weeks. Have you experienced any of these symptoms? And that's kind of where we start looking at the severity of someone's symptoms, where it looks at mild, moderate, and severe. And like I said, blood
People
work.
have a lot of questions too about these tools, and we use them more and more because unfortunately depression, like many illnesses, goes underdiagnosed. It often gets swept under the rug or doesn't get to the top of the problem list when other people have other things, and increasingly when, you know, appointments are rushed or not enough time. So these standardized questions, we know, while they seem a little bit annoying or perhaps cold, they actually do a pretty good job of identifying if people aren't doing so great, and then it can, you know, bring it to the surface earlier to your, you know, your doctor, your nurse practitioner to address it. So they're an important tool in kind of, again, raising awareness and helping make this diagnosis for people who are, you know, suffering from depression.
Yeah, I mean, I've been someone who I've struggled with anxiety for a long time in my life, and it's something that I like to talk about because I think it's important to destigmatize these type of things. And I know that early on that there's a longer process that can go on in order to you know, cure you know, the physical symptoms that you're feeling. But what are some of I know in my experiences, there's been some things that have been given to me early on to kind of help cope in the meantime while either the meds kick in or you know, whatever it might be. So what are some of the techniques that you have your patients use early on while they're working through?
I mean, we'll do like deep breathing exercises. I try to identify the cognitive distortions. So what are they doing? Are they self-labeling? I mean, we all do them. We all have them. We all self-label. We all think about things that haven't happened. We think it's imaginary. It's all fake, you know? And that's kind of the things that lead to that leads to anxiety. Thinking about future events that have not taken place. Like, what if I do this? What if I could have done that? But what if this happened? But I should have done this, and all of that, you know, like situations like that. When we're never, I mean, well, not when we are, but some people just aren't in the moment and they're thinking about all these different scenarios, or they're halfway in their past thinking about things that they could have done, should have done, and that contributes to the anxiety that they experience throughout the day. So I just try to explain to them that try to be in the moment right now, so this way you can shut that down. Like, you don't need to go backwards, and the things that you're thinking about have not happened. It is not realistic to be thinking about things that are completely imaginary. So that's one of the techniques that we utilize, is being present, meditation, things like that, identifying the distortion and trying to do distraction or other techniques. But once you identify the distortions that you're doing, I find that for people it becomes easier for you to start coping through things, but that doesn't always work. So we do use different agents of medication to work through depression and anxiety. SSRIs are first line, and a lot of people think that antidepressants are just for depression. They're not. They're actually FDA approved for the treatment of anxiety as well, but sometimes people need as needed medication. So there's other medications that can be used. I'm sure you can speak on that too.
Yeah. And in terms of, lifestyle, therapy, other strategies, one of my favorite, if I can get people to try to, just because it's multi-beneficial, but it's actually exercise. I think there's pretty, decent evidence that, moderate exercise is as effective as kind of a low-dose antidepressant. So for my patients who are really struggling, who are anxious, who are, kind of just lack of energy, I tell them to exercise, get out there. I mean, it is such a good therapy for a variety of things, but the more, I tell people, the more we move, the more we want to move, and the kind of the neurochemical benefits of exercise also treat a lot of things. Is it going to fix every single case of depression and anxiety? No. And if it's severe, like Amanda said, there are medications that help. There is, kind of more intensive counseling and things. But if you are kind of on the brink or just kind of feeling down, if you're not exercising, we encourage, if you don't have anything that prevent you from doing it, start, because it's a great Kickstarter.
Yeah. Sometimes we use medications like benzodiazepines. Those are like the Xanaxes, Ativan, Klonopin. Those are used only as needed. Like I try to tell people, you should only take that unless you're considering going to an emergency room. They shouldn't be taken daily, very sparingly. I mean, there are some people that you wouldn't want to see without their, medication, but they should only be taken as needed, because they do have the potential to cause dependency, tolerance, and now they've been linked to increased mortality rates. Like these medications can't kill you, like some of them, like the ones that have the potential for tolerance and dependency. So I like to use clonidine, propranolol. They're blood pressure medications, but they work very good for anxiety.
Before, I think in terms of, we'll get to the treatment, but also who's at risk for depression? Because certain people are more at risk. You can correct me wrong, but certainly it actually affects women more than men, typically. Younger people versus older adults in the community. Is that it?
That is absolutely correct.
And with the exception of elderly people or older people who are perhaps going through a severe illness or in a lot of pain, or on a lot of medications, or perhaps are kind of alienated or alone, they're at higher risk for depression. Am I right?
Yes.
Yeah.
So just take a few questions here. We actually have a few lined up. The first is from Eunice. And she's asking, is it true that most people from New England have a D3 deficiency? Is that a question either one of you can answer?
D3 deficiency? Like, are you talking about dopamine?
I think, or is it vitamin D?
Like vitamin D. Yes, because we live in New England, most people do have a vitamin D deficiency versus like California, because they're obviously surrounded by the sun. So is it helpful to take a vitamin supplement? Yeah, that does help. I mean, if we were to test the levels, I'd say a lot of people would be deficient. Would they be, extremely deficient? Maybe not, because you can also get vitamin D in your diet as well, depending on how you're eating.
And the second part of our question is, do the symptoms of being vitamin D deficient mimic depression?
Yes.
Of these? And how do you rule that out?
Energy.
Is that through blood tests?
Work. Yeah, I usually do it, and you just have to make sure that you write the right code, so that way your insurance pays for the test.
Excuse my clinical ignorance here, but stapedectomy? Anyone familiar with that? We'll come back to that one, Henry. Sorry, I'm probably butchering the pronunciation here. State STAPEDCTOMY. We'll come back to that one, Henry.
Okay.
We'll take a break, and when we take a break, we'll talk about it. See if we can come back and answer that question. I want to flip over now to our Google Voice chat, take some of your text messages. Do you have any strategies for those of us who find the holidays especially stressful or hard?
I do. So if you're feeling very stressed in terms of like, in general, just take time for yourself. Maybe volunteer, set realistic expectations for yourself. It's okay to say no if you're not up for something. Just don't do it. I mean, you don't need to be the next Griswold and decorate your whole house. Maybe you put out a wreath and that's the end of it. If you don't feel like putting up a tree, maybe do a Charlie Brown tree. Remember what's important. I mean, it's a season of love. It's about giving, gratitude, being with family. It's not about what you bought and who bought what, who bought the best of this. It's about being with each other and treasuring the holiday, whichever one you may celebrate, and enjoying those moments together as a family. Maybe make it about food or surround it around something else. It doesn't need to be around toys and gifts and all these other materialistic things. And have healthy conversations. If there's drama going around, you don't need to react to it. Not everything deserves a reaction. And seek support from people, your loved ones. Reach out. Don't be afraid to talk to somebody, to say something. As you can see, I mean, it affects a lot of people. 1 out of 5 people struggle with a mental health disorder, be it anxiety, sleep disorders, depressive symptoms. So it's very prevalent.
I think a really good tool to, I think, help with mood, and just if you're going through tough times also, especially if you've experienced loss, or is a daily gratitude list. Like if you, right, you take, I tell my patients this, I do this personally, I do this with my children actually, right? You think about and you talk about and you say it out loud if you have someone to share it with, and if you don't, you just do it on your own. Like, what are you grateful for in your life? Because we often have tons of things we're grateful for, and that actually helps a lot of people in terms of bringing them back to what Amanda said about being in the present now, not worrying about what happened in the past, not focusing on what could come down the pike in the future, but bringing right now. Most of us have a lot of good things in our lives.
Exactly. I like that, because the mind always goes somewhere negative. Like if you think about it, like it never goes somewhere positive. Like, oh, I look good today, or oh, this happened. You always tend to focus on something bad, or you nitpick at yourself or others. And so writing down, like I usually say the same thing, like write down 3 things that either you love about yourself or that you did good today. That helps with self-esteem building too. And also just maybe 3 good things that happened, or 3 things that you're grateful for. I like the number 3. I stick with 3. I think it's good.
Yeah.
So we have a question about a 3-year-old with an obstructive sleep apnea. I can say that none of us here are experts for pediatric care, so my advice would be to call a pediatrician, or Southcoast ENT is a great option. They deal with ENT being ear, nose, and throat. They can deal with those types of issues. So if it is a physical ailment, they'll be able to take a look and help figure out. We also have sleep labs here.
To that point, I think just for everyone out there too, I think we will plan on hopefully having a pediatrician on the show. So we can I am in internal medicine. I specialize in taking care of adults from a primary care perspective. So I apologize that I can't speak to pediatric questions and concerns, but we have several great pediatricians who we work with. And so in the future, we can certainly line that up. And also, we should take the time tonight to ask people if there are topics that you would like, or specialists that you would like perhaps us to invite onto the show, to send those comments and questions in, right, Pete? I mean, so we
Yes,
could
absolutely.
do that, because this show's here for everyone to get as much benefit as possible.
Absolutely.
Yeah, and I'll preface that with saying that we have got a few very specific questions tonight, and we will try to work. It's very difficult to ask Dr. Podkoa or any of our guests to answer any really specific questions. Those are questions that you really should ask, your doctor or whoever it is that you're seeing on a regular basis, because it's hard to. We have a question here about from a fiance breaking a humerus bone Sunday night, having some issues with sodium level on fluid restrictions. So generally, when you've undergone a kind of a traumatic event like that, and you're back at home, but you're feeling like just something just isn't right, what's your advice to someone in that situation? Should they just come to the ED?
Yeah, so I tell people to trust their gut. First of all, if you don't feel well, or if you're caring for someone who may not be feeling well, like usually, kind of go with your gut. And then oftentimes there is a variety of mechanisms of which you could seek out care. There, perhaps is a doctor on call with your primary care practice, or the doctor who cared for you, whether it was a specialist or not, so you can reach out to them. They're often available.
Yeah.
I think it's a great first line because hopefully they know you and what you've been through. It's convenient, right? There's urgent care, which have extended hours, and kind of the last resort is the emergency room. But I would really first kind of, just think about if it's not life threatening, if you and this is hard to say, but if you thought it could wait till morning, but you had a question about it, you can call someone. If you thought, God forbid, that it was severe and that if it didn't stop or it was kind of escalating quickly, then certainly the emergency department's more appropriate for that.
Or
But
the on-call.
yes.
Is another very specific question about back pain from Chris. Generally speaking, if someone has back pain, what would you recommend?
So it's a broad topic. Unfortunately, 2/3 of adults will suffer from back pain at some point in their life. The questions is, what causes it and what are the symptoms? It can be as simple as a pulled muscle to as complicated as, some sort of disease state that's affecting the bones. So I think you should get it probably looked at by, ideally, I think primary care doctors are really well suited for dealing with, back pain. Urgent cares are as well. If you don't have a primary care doctor, we can certainly do that. And to kind of flesh out what are the signs and symptoms, when did it start, how long has it been going on for, or what have you tried, and to kind of narrow down what exactly is causing it.
So Henry, thank you for getting back to us a little bit more information about your question about again, I'm going to butcher it, but stapedectomy. He has said that it's a procedure done to the middle ear to help someone who is deaf to hear better. I think that's probably a great question to maybe Southcoast
Yes.
ENT again. There, it's very specific. It's something that a specialist should really help answer for you. So again, Southcoast ENT, Dr. Feineman, she's fantastic. You can look her up at southcoast.org. That was a great question for her. You can give them a call tomorrow, and they'll give you guidance to where you should go to get more information on that procedure. Question from Tiffany here. Lumps under armpits, is this something to be worried about?
Sounds like an ingrown hair. But I'm not an ENT
Yes.
specialist.
Yeah. A great pearl of advice I read once in terms of, noises from your transmission don't go away. Lumps or bumps under your armpits, usually
Right.
you shouldn't ignore either. Yes, it could be as simple as Amanda said, an ingrown hair, or it could be, something as worrisome as, God forbid, a lymphoma or enlarged lymph node. So certainly something that should be, looked at, investigated further. Ingrown hair, would be simple, just red. Signs and symptoms of something more serious would be, night sweats, weight loss, just fatigue and malaise. So it could be nothing, but it also could be something. So it's definitely worth seeing. Either your primary care doctor again, or perhaps an urgent care.
This might be a little bit too specific, but Alexander is asking about electromagnetic frequency. Any opinions on if there's a health risk there? I know I can speak personally. When we purchased our home, there was I won't name the company, but there was a big sub-plant behind us. So we thought long and hard about and did a lot of research on EMF and its effects on people. And I actually watched an interesting piece with Neil deGrasse Tyson recently, where he specifically talks about electromagnetic fields and the studies of it, and he talks about how in science, when you do enough studies, you eventually will get a positive result on pretty much anything that you study. And a lot of times when you get that positive results, those are the ones that make the headlines, and those are the ones that create concern for things like EMF, despite the fact that there's not a lot of scientific evidence that points to them causing lymphoma or causing any kind of cancers. So I would say that, in my own opinion, and you guys are both welcome to share anything you feel, things like that, I think it's, you got to do your own research on, and I think the jury is still out on those things. I don't know, do either of you feel?
I can't comment or feel comfortable commenting on it, unfortunately.
Yeah. All right. So why don't we get back to vitiligo? Vitiligo?
Vitiligo?
Vitiligo?
Yes.
Is it common for it to go away and for color to come back in pigment?
So it's a question of, for people who are listening, discoloration of your skin. If some people get a white discoloration of their skin, I'm not sure what happened there. And so again, just make sure it's the right diagnosis. It's also often, it's caused by a fungal infection, believe it or not. It's treated very easily with oftentimes a shampoo, sometimes pill therapy, and it can go away, but unfortunately it can come back. It's often worse in the summer because people more notice it when they get exposed to the sun. But if it is the right diagnosis, it is vitiligo, it is treated, the skin pigmentation can return to normal, but unfortunately it can come back as well.
Sherry, great advice from Sherry, I think, here. She says that a good support system helps with depression. Getting involved in something that interests you. She says volunteering at a shelter if you love animals, being around people, positive people is a great thing to have. She says, push people to get into your way of thinking, and it can help. That sounds like pretty good advice.
Yeah, reaching out to people.
In talking about depression, and besides just not feeling well, and kind of the lack of energy that can come with it, there's reasons why we worry about it. I mean, it increases risk of suicide, unfortunately, which, right, we can talk about.
Yeah, our suicide rates are the highest that they've been in like 30 years right now. I mean, they're out of control, so it's important for people to know that it's okay to reach out for help and to identify, who's at risk,
And it affects people's ability to go to work, so it affects from an economic standpoint, and people can lose their jobs or just not functioning properly. It affects people's concentration. So many times I worry people's, I'm talking about, they just have trouble concentrating, or they're just forgetting things. I have people who come into me and worry about my memory doesn't seem as great, and actually can affect these things as well if you're functioning with a level of depression. It can affect relationships, right? And it affects your sex drive. You can affect, it can cause people to drink or use other substances, which can compound a problem already. In the addiction world, there's often a lot of dual diagnosis in terms of people who are struggling with their drug and alcohol use, and also perhaps what may have led to it or come from that is depression or anxiety and bipolar disease.
So depression's hard enough on the person who's suffering from it, but we have a question here about a friend. A friend is worried about another friend who is suffering from depression, and my assumption from the question is that getting to the point of that this friend is worried that they might harm themselves. What's your advice to the person who has someone in their life who they are worried about?
Tell their family, talk to them, get them help, give them access to the suicide hotline, tell them that you care about them, let them know that there's resources, get them in, maybe even offer to go with them, make sure that they have a safety plan in place, like it's okay, you call me, I'm here for you. Let them know that there's always services around, but I mean, you can't take anything lightly these days. Like if someone told me that they weren't feeling safe, I would go get them help. I would either take them somewhere, take them to a hospital.
So there are crisis centers, right, which are there in New Bedford, that are specifically for mental health if someone is suicidal or is having other kind of mental health problems. If you're not sure, you can bring them to the emergency room. Certainly they can help sort that out, and those resources are 24 hours a day, 7 days a week.
You could always call law enforcement as also, or someone else to check on them.
I've seen a lot of stories recently about suicide rates being much higher in teenage girls currently than they have been in the past. Have you seen those reports, and any thoughts?
I can't comment because I haven't seen those reports. I do know that the suicide rate is higher in the last 30 years in general. So I know that there's Esper is a tool that they use a lot, especially in, I don't know if you guys are familiar with Esper over at Southcoast. It's just another screening that's being done now to assist in seeing if someone has the potential.
Is there a reason why? Is there a reason why that they believe it's up in the last 30 years?
We know, that again, depression is more common in women than unfortunately for men. We also know that 16 or 18 to 24, when you start antidepressant therapy, they actually have a higher risk of suicide compared to the older population. Like middle-aged people, 30 plus, starting on antidepressant medication, we could talk about, respond very well, often start feeling better within 2 weeks. Younger people, adolescents and young adults, feel better as well, but you have to watch them more carefully for increased risk of suicide. Amanda, you can correct me if I'm wrong, but part of that is because it energizes them, right? Like perhaps.
Well, there's a black box warning on all antidepressants up to the age of 26 right now, because I feel like it's because the brain's also not fully developed. Is it the prefrontal cortex? So it's not fully developed until that age. So you also figure teenage girls, they're hormonal as well, so their hormones are up, they're down, so that could also play a factor in it as well. So.
Some risks or things that put people at higher risk for depression. I mean, for suicide that I've looked at, and is one, a family history of suicide. So if a parent or a close relative has committed suicide, it puts someone at higher risk. Age, gender. Actually, women. Correct me if I'm wrong. Women are more often to try suicide, but men are often more successful at committing suicide. The highest risk, I think, for someone for actually committing suicide is if they had a suicide attempt within the past year, that they are at higher risk. So if you know someone or yourself, kind of go through things, it should be an alert that you should seek help, because you should take that seriously.
Well, I think it's a good point to take a quick break. Josh, if you want to roll video number 1, we'll be right back in about 30 seconds.
People, actually come up and they're like, I gotta hug you. And it's like, this is the first time in X amount of years I've not been in pain. And we get that feedback every single week. Integrating the nurses, integrating physical therapy, that is all part of the treatment strategy, the treatment algorithm. In a matter of weeks, matter of months, they're now able to have the life that they want to live. And that's really more than medicine.
Hi, welcome back. Amanda, can you tell us a little bit about what you do and about your practice and where it is?
Sure. So I'm a psychiatric nurse practitioner. I treat individuals across the lifespan, starting around ages like 12 to 14, up to the ages of across the lifespan, so into geriatrics. And we treat mental health disorders. We're located in New Bedford on Brigham Street. We're currently taking referrals if you're interested. Call us.
And you work with not just yourself, but a host of, you have a whole team, don't you?
We have Caitlin Picard. She's our other nurse practitioner. She's a Mass General graduate. She's amazing. We also have a social worker as well, and we're rapidly growing. I feel like in the next, we're actually in the process of opening a second location, and we hope to have that building filled with other providers, including neuropsych, as well as just other clinicians, counselors, social workers.
Do you find that people with substance abuse issues, and not getting to the extreme of maybe heroin or real bad opioid addiction, but maybe drinking and more of the social drugs that people use, do you find that this time of year that ramps up for people?
Of course, stress is can also attribute to that. People become sad, so they start self-medicating with other things like drugs to make them feel better. They're looking for an outlet. They just want to feel better. It can be very debilitating when you don't feel well and you just want something to just numb the pain. So,
very common thing that I see is we talked earlier. So depression affects sleep and anxiety.
Yeah.
So what happens a lot of times is people aren't sleeping. They're laying in bed. They worry. They're thinking. They're tired. And for a lot of people, they start to drink. They think that helps them put them to sleep. And then what they don't realize, actually, alcohol just causes you to sleep less effectively to begin with. So they have to drink more. And then that also affects the mood and brings it's a further depressant down. So it becomes a bit of a vicious cycle of increased depression, increased not good sleep, which can put you for more depressed. And so it's a cycle of things, yeah.
And the drug-to-drug interactions with their other medications, if they're on already other medications like a blood pressure medication, and if you're drinking while taking a blood pressure medication, you can tank your pressure and pass out. I mean, it's extremely dangerous. So I always educate my patients about the extremes of things. Maybe I go to a little extreme, but I'm sorry, I can't help myself. I want, like you had mentioned, I want my patients to wake up. I want my clients to wake up in the morning. So
Yeah.
that's something that's very important to me.
You know, when I take care of patients and see them, and I'm not sure you see this too, Amanda, but some people are worried about, like, they feel it's a weakness or that it's a character flaw, that, you know, in this depression, that it's not a real disease. And I try to tell them it absolutely is, because the symptoms are so uniform. You know, I try to say, like, people who have heart attacks have very similar symptoms. You get chest pain, arm pain, jaw pain, you sweat. It gets worse when you exert yourself and when you rest. And then, you know, and it's a, you know, people recognize heart attacks as a real disease, but the people who are depressed, they have the same symptoms uniformly. I mean, you see them, they are feeling depressed. They lose interest in the things they like to do. They have trouble sleeping. They cry a lot. They feel excessively guilty, you know, and so people, you need to, we do a good job of reassuring them that this is not a character flaw. This is not you being weak. This is not, you know, you're a baby. You know, this is an illness that has to be corrected, you know, and the sooner we intervene on it, whether we get them into counseling or we get them on medication, the faster they come out of it, which increases your risk, you know, increases the chance that you're not going to go back into it, that you'll be on medication for maybe 6 months versus a longer period of time. It's really important, correct?
Exactly. I tell people, just because you're going on something, it doesn't mean that you're going to be on it forever. This is something that you're just going through. Some people stay on it for a year. Ideally, when you have a depressive episode, you should stay on it for about a year. That doesn't mean that you're not going to come off of it, depending the severity of your depressive disorder or this particular episode. We don't always keep people on it, and medication isn't meant to change you. It's just meant to stop the symptoms that are taking over your life, that are taking away your ability to enjoy the things that you once did. You know, so then when you come into an office, it doesn't have to be a conversation like, did you take your medicine? Are you still doing this? It's more like, hey, how you doing? Oh wow, you went on vacation? How was that? Great. You were, you know, skiing last week or something like that. It doesn't have to just be about the other stuff. It can just be like, what are the things that you want to do?
And we're lucky that there are a number of different types of medications nowadays that we can use to treat depression and anxiety. Like Amanda said, they're often the same type of medications. They are really well tolerated. They're, for the most part, most of them are very inexpensive. There's a lot of generic options now, and which is great. You know, people worry about some of the side effects of them. For the most part, they're pretty minimum.
Benign.
And we can match them to some things that, you know, some people maybe they may lose their appetite when they get depressed. So there are medications that make people hungrier, and we use those for those types of people. There are people who have trouble sleeping, right? And so it's a really, you know, we're fortunate to have such a broad array of therapies for people to get better.
Of course.
That's a great. It was a great segue. Actually, there was a question about the fear of from one of the viewers here about the fear of putting a foreign substance into their body. And I can speak from experience. I've been on an SSRI now for about a year, and I had that same apprehension, same worry about getting started. And I know for some people that the whether it's a placebo effect or not, those first few weeks can be a little bit difficult. But once you get over that, I can tell you that in my own personal experience, I'm so happy that I made that decision and I've done it, and it's been a year, and I continue to use them daily, and I find it's really helpful.
It can actually take up to 4 weeks for an SSRI to start working. So oftentimes when I get somebody that's been seeing their primary care physician, they'll already have come to me and have taken like 4 different SSRIs or other medications. And they're like, nope, didn't work, tried it. How long were you on it? About a week, nothing happened. Right. And I can't help but like almost laugh because they never gave the medication a chance to start working. And granted, when you first put something in your system, I mean, it is something, it's different. You're not used to it. You may feel a little, you know, maybe have a headache, maybe feel a little sick to your stomach, but that does pass if you even get it. That's not to say that everyone who does take something is going to have a side effect. The pharmacy, those packages, they have to list every single possible thing that could happen. They have to by law. But if you actually go into the FDA reviews of the medication, you can actually review the percentage of people that did experience a side effect versus the placebo group. So that's also a good tool. Most people don't like taking medication from ICU. You know, I mean, people kind of cringe when I say, I think you need a blood pressure medication, or I think you need a cholesterol medication.
some people like medications, and that's kind of a separate problem,
Yeah.
but I will say in terms of convincing someone to take a medication for the depression or anxiety is actually extra hard. Yeah, it's very humbling for people to say, I'm depressed and I think I need medication for it. It's I would put it up there with convincing people that insulin is the right choice when they're diabetic. It's another really hard choice for people to make. They're worried about it and they're scared. So I empathize with them. It is concerning. You try to, and unfortunately, like Amanda said, it doesn't work right away, which that doesn't help either. In a life and in an era where we are used to instant gratification and feeling better right away, and Advil works in 4 hours, and why? So it's a bit, kind of coaching them that it's not going to work right away. Sometimes it can actually make your anxiety a little bit worse in the beginning. You have to be careful around that. And these medications, we use these terms. So the SSRI is called selective serotonin reuptake inhibitor, and they're kind of a newer generation of medications that are out there, and you commonly probably may have heard them. Initially, the first one was Prozac. It was very common for a while. Now it's Lexapro or Zoloft or Paxil.
Or Trisolax. Or
Yep.
I'm on Celexa.
Yeah, and so.
Cymbalta.
Yep, Cymbalta. And there are different classes of these medications, but they do work. They do take a little bit of time. We try to line up with people what we think will work best for them, but there's a bit of a trial and error, unfortunately, with it, right? Like everyone's a bit different.
Yeah, actually, I was going to speak to that. We
Yep.
also do genetic testing as well. So what that is we take a swab of somebody's mouth. We can actually ship it off to a lab, and they can send us results, or they'll actually, send us a result and tell us what medications work well for you based off your genes. It is the most amazing tool with GeneSight, or they actually have other ones too. Millennium, I don't want to say I'm biased. Quest also does it. So other labs do this, and it is great. It gives you, and your genes are your genes. They're never going to change. Some insurances do cover this for a cost or with a prior authorization. That's basically when your insurance doesn't want to pay for something, they will send an information request to your provider for the medical necessity part of it. Then we have to fill out some paperwork, and then it's approved. Otherwise, I think it's like a $500 test. Or they'll work with you in payment plans depending on the level of income that you have.
That's great. So we got about 10 minutes left. Let's take a quick break so we can regroup. And please, like I mentioned, we have about 10 minutes left. So send any last questions that you might have. We'd be happy to answer them, of course. So we'll be back in about 30 seconds.
Teamwork is indispensable. We don't have cardiology and cardiac surgery separated the traditional way.
All these people come together and treat the one patient. It takes that collaborative effort to provide the best care for patients.
That's what makes us different at Southcoast Health.
We're one of the best cardiothoracic surgery programs in all of New England.
That is more than medicine, I would say.
Welcome back. We have about 10 minutes left, so please send your questions along. Again, it's been flashing on the screen throughout, but you can either comment below on Facebook or you can text us anonymously. And again, that number has been coming up, but it's 508-717-8948. Again, 508-717-8948. That is completely anonymous. If you want to kind of ask a personal question that you're not necessarily comfortable asking, under your Facebook account. So, while we're waiting for some additional questions to come in, let's segue to actually perfect segue here is that we have a comment from Alexandra who kind of talks about just being more natural and maybe not relying on meds, and I think that's a personal preference. But if you are someone who wants to try the natural route first, what are some of those options?
Okay, so I would say go with a lab or a vitamin company that does not manufacture their vitamins in China. Oh, don't do that. So, because you never know. So I like, there's one in Sudbury, there's Douglas Laboratories. Valerian is something that is good and has, it's great for sleep. There's melatonin, and the valerian has properties that are similar, has effects that would help with anxiety. I've heard things about kava, and there's just I know that there is evidence-based research on the valerian and the melatonin, so those two that I could definitely speak to. There are others though, and there are other physicians and clinicians that do practice in a natural, way in terms of like vitamins that they not prescribe with vitamins, but they make recommendations with. But I would say that it's Pure Encapsulations is the vitamin place in Sudbury, and you can order online.
Lifestyle things I like to tell my patients as well, we touched on before, but in case you missed it. So sleep is super important. We notoriously underestimate the importance of sleep. Most of us, if you are not getting enough sleep, it's a bell curve, so not one size fits for everyone, but if most of us would probably need about 7 to 8 hours of sleep a night. Some of us need more, some of us need less, but just making sure, one, that you're getting enough sleep at night, and it can certainly affect mood. We talked about exercise, we can revisit it again.
Yoga.
Yes.
Love
Yoga, objects in motion stay in motion. So exercise and trying to get 30 to 40 minutes of exercise most days of the week is a really good thing for protecting your mood and your energy levels. Talking to people, whether it's friends or I'm a huge proponent of counselors. I think there's really good evidence that they work. They work either alone or in conjunction with their medical therapy, but identifying with and kind of establishing a relationship with a good counselor to talk about. Life throws a lot of things at us, and it's not easy. So I think that's another great non-pharmacologic or non-medication option for people.
I've been told by a health professional that 3 hours of rigorous exercise a week, 8 hours of sleep a night, and a healthy diet can have the same physical benefits to your body as being on an SSRI or
even
having
like 30
medication.
minutes of meditation.
Yes.
And so and meditation was something that I used, especially early on while the meds were kind of coming up to speed. Guided meditations on YouTube.
Heads Up is a great app I recommend my patients use. Yes.
Yeah, there's phone apps, a dozen of them that you can get that have free trial periods where you can go through a few days worth before you have to pay anything. I found finding that center really helped me with my anxiety. I can't recommend meditation enough to people who I find that a lot of people who I talk to about this says, well, the worst thing for me is being in my own head. That's what causes my anxiety, and I was there too. But I think once you get past that, meditation can really help and is very beneficial.
And certainly limiting alcohol and obviously drug use, smoking are known kind of contributors to kind of being depressed and mood. And I think eating a healthy diet, I think bad food, bad mood is a really kind of, my patients are probably retired of saying that, but it's really true. I think just eating cleaner, healthier can help, kind of get you back on the track of wellness.
And just rapid fire here, important question I want to make sure we get to, question about someone who has tried several different SSRIs and just isn't getting the positive effects. They're asking, what are their other options?
So I would first look at if they've not had I'd look to see if there's any family history of any mood disorders, maybe do adjunct treatment with an atypical or a mood stabilizer. Are they in therapy? How's their diet? Are they sleeping? What are they putting into their treatment? Pills don't fix everything. That's why we've incorporated that you need to do, it's encouraged that you do therapy, that you do have a clean diet, or at least getting 3 meals a day, not skipping meals. A lot of times people will not eat all day, eat 1 meal at night, and then they're like, oh, I'm so anxious, or I'm depressed, or I feel down, or I feel low throughout the day. Well, you didn't eat all day, so you didn't consume calories. So making sure that you're at least getting 3 meals a day and snacks,
Just like
the minimum.
High blood pressure, often it takes more than one medication for the first attempt, so don't get discouraged, because if you've tried a couple different medications, perhaps that, like Amanda said, it could be other therapies that can add to it. And it's not uncommon for it not to get better right away.
Or get a gene test in. Maybe look to see, maybe it's how you metabolize medication. Maybe you either hold on to something too quickly, or
and as a primary care, that's sometimes where I refer to someone who specializes in mental health, specifically like Amanda. It's like getting kind of a dedicated psychiatric professional to look at you and evaluate you.
Something to that nature. Yeah, I agree.
Excellent. Well, any final thoughts from either of you as we wrap up here?
Well, I would say as everyone approaches the holidays, make sure that you're acknowledging your feelings, taking care of yourself, and just setting realistic goals. Okay, we mentioned earlier that you're not alone. You don't have to go through this alone, and that there is help out there. And thank you so much for having me today. Thank you, John.
No problem. Thanks, Amanda. I would echo the same sentiments that, we wish everyone a happy holidays here, to be grateful for the things that we have good in our lives, to be, to be kind to everyone around us. If you are, suffering or concerned about depression, feel free to reach out to, I think, your primary care doctor, your family and friends. If the show, maybe you think someone would benefit from it, please share it, or and maybe tag them to look at it. Or if you don't want to tag it, but just kind of pass it along. We think this is a great public service opportunity to increase awareness about a variety of topics that we know every day people kind of go through and suffer from, whether it was depression tonight, diabetes last week. We hope to keep bringing to people in a convenient format an opportunity to discuss things that affect many of us every day. So please, if you can, pass it on. Also, kind of let us know what you'd like to hear about. Yeah. We would like to help as many people as possible.
This video will be available archived on New Bedford Guide for anyone to go and continue to comment on. Again, you can send us your comments there on additional topics you'd like to talk about. Also, if you've been viewing, if you've been watching, you should have our phone number now, which you can text at any time with questions, and we will be happy to archive those questions until the following show. We can even rehash them then. Josh, if you don't mind popping up the schedule for the upcoming shows, we're pretty much to a weekly format now. So we'll be back next Wednesday, December 6th, and we're going to have some folks from our Visiting Nurse Association here. We're going to kind of build off of this topic and talk a little bit about, they'll be able to talk about grief and specifically during the holidays, if you've lost a loved one, what are some of the techniques and some of the things that you can do. Then the following week we'll talk about eating healthy during the holidays, and for those thinking about making a New Year's resolution to eat better, lose some weight, some tips from a nutritionist about that. And on the 20th we will talk to some of to a midwife and one of the doctors from our maternity department. For any of you out there who are either trying to get pregnant or are newly pregnant, and if you have any questions, the wild world of children, anything that might be on the brain that you want to ask, and then December 27th, we're actually going to take that week off. It's the week between Christmas and New Year's. We figure folks will be out trying to either recover from Christmas or get ready for New Year's. So after that, we'll be back in January. So we will see you next week. Thank you so much. And just to, again, piggyback on what Dr. Podkoa was saying, we want this to be your show. All of the Southcoast region, New Bedford. Send us your questions. We really want to tailor this to what you want to hear about and talk about. And this is your show. So again, please keep the questions coming. This was a fantastic show today. Thank you both so much for coming in. The engagement was fantastic, and hopefully we can do this again sometime.
Thank you, and happy holidays.
Happy holidays, everyone.
Happy holidays. Take care.